everybody, my name is Mona Chiso. So today we'll be talking about another journal video. So I'll be presenting in a scenario that gives more on that will give me more understanding about the role of a psych nurse MP. Also, using one of the clinical encounters during this week, I had a patient, a 44-year-old lady that walked into the clinic. So she came with symptoms of fatigue, tiredness, and not just feeling herself. I used active listening and interviewing to get some questions from her to know what her whereabouts and everything that was going on. I realized that beyond the physical tiredness and beyond the physical presentation of tiredness and fatigue, there were other things going on. Her affect could tell me everything. Her mood, her mood, everything going on with her, even the volume of her speech, her words, everything could tell me that this is beyond just physical tiredness. As a psych nurse MP, it is very important. So I realized that it's the diagnosis of a patient, or on a day-to-day basis, we will be able to diagnose a patient beyond physical presentation, because according to her, she is tired, she is fatigued, but that's not just it. There were other things she was saying that made me like realize that probably she could be depressed. So during this period, my strength during this encounter was ability to ensure that the conversation was like a safe place for her. So this I was able to actualize that by using like nonverbal affirmations, by using active listening, by using active listening, using open-ended questions to get more information from her. So that made her feel safe with me. That made her tell me a lot of information, and for me to gather more information to be able to diagnose her and put a treatment plan and put a plan in place for her. However, I had some limitation because at some point I was struggling with open-ended questions and closed-ended questions. Open-ended questions were more important during this scenario, because through that I was able to explore a lot of things from her rather than using like a yes or no question. At some point, at some times, yeah, I was using no yes or no questions, which is one of my limitation during the interviewing. So, considering about therapeutic use of self, I was just trying to align just mere burnout, just the physical burnout we all experiences as a nurse, to like psychological burnout. This made me like be more empathic with her situation, to be more empathic with her condition and all that. However, I was able to validate her experiences so far without jumping into any conclusion, or without saying without like judgment. However, the most important thing I learned during this clinical encounter is the ability to read between lines. Reading between lines means ability to be able to realize or able to know what is not being said, because patient did not say I'm depressed. However, her affect, her mood, her speech, everything was in alignment with her physical symptoms. So sometimes it's good to like look beyond or think beyond what the patient presented with. So as this that's one of the things I've learned this week. Also, I learned that talking about the learning and reflection, I learned that empathy is very, very important, and also non-verbal affirmations. It's very important, especially for patients with depression, patients that are passing through a lot. Sometimes you don't have to like jump in, you don't have to like confirm verbally. Sometimes you could nod your head, sometimes you could look straight to their eyes. It's a kind of like affirming to what they are saying. It shows that you're listening. It kind of validates active listening. So in conclusion, I would say that the most important thing I've learned this week as is regarding to this role of the psych nurse MP is to listen attentively to patients and also think and reason beyond mere physical presentation. Think and reason and think beyond mere presentation or beyond anything physical that is going on. Thank you very much.